Thank you for keeping it TV 47. Of course, this is Body Garage, where on this episode we are focusing on ear and hearing care. And with me is Dr. Mwangi and Daktari. So before even we continue to some of the treatment options that are available, what is this machine that has been beside us the whole time? What does it do? And when someone comes in for a checkup, what do you do?
Okay, so ENTs, we like to say we work in small dark places. So light is of the essence. So every time when you see us, we might have this big gadget that we call the headlights, which is basically our light source when we are examining probably your nose or your throat. The ear, remember it's a cave, it's dark inside there. So there's what is known as otoscopy. Right? Otoscopy is basically we're using a magnified instrument that is able to visualize into your canal. Technology has changed. You also want to see how cool your ear is. So with this, we also are able to connect to video imaging, and we're able to show you your ear on screens. That's examination. We can look with cameras in your throat, in your nose, and in your ears. Right? And then now we can talk about, that's looking. Now we can start talking about function. Because you know, a non-hearing ear does not mean a broken ear. It can look cool, okay, but I tell you, you still tell me, I can still hear. Then that's the time we talk about hearing assessment to look at function. Yes.
And how often would you recommend for someone to at least get a checkup?
Okay. Remember we said hearing loss is an invisible disability. Please be mindful to do it at least annually. Okay, when you are on the older spectrum, you want to do it more often. Remember, age is a factor. But at least once in a year or once every 2 years, please get your hearing assessed. Fortunately, there are so many stakeholders that are coming on board, because we can say at-risk workers. If you work in a place that has high levels of noise, if you work in a factory that has a lot of machinery, if you work in customer care, which means there's always constant telephone calls, if you work in an airport and there's all these noises, the factories, all these companies actually do annual checkups for you, whether you complain or not. And those are important things that people who are employed in those areas that should know that happens.
Okay. And now when someone is getting, I'm sure with eyes, there's the eye test. So with hearing, there's the hearing test. What do you check for? What do you test for during that time? What are the tests that I will undergo?
Okay. So we said two main functions, hearing and balance. So you can actually test for both. Whether, and when you talk about hearing, remember we said even a day-old child can be assessed for hearing.
Yes.
And even know to what level. And this is because we have what is known as pediatric assessment, which does not rely on the child getting us feedback as to whether they tell us whether they can hear or not. Because even a 10-month-old doesn't even know what you're doing, right? But because we say that this is translated into a neural signal, it creates a pattern. If this pattern has to go A, B, C, D at normal levels, but I have to put this level at a higher volume, there was the hearing loss. So there's what is known as ABR, which is just a test that is not limited to the patient telling us whether they're hearing or not. This also works quite well for malingerers, for those people who want to say, hey, you know, every time when I'm in the studio, you guys have been making noise and I can't hear, and it's because of those studio. Whether you like it or not, that test will tell us if your hearing is 100% or not. Now, over and beyond, of course, there is other tests that will probably take 30-40 minutes, and you're able to get to know your hearing at different levels. And when you say different levels, hearing loss is not just a broad term. There's also grading. You can have a mild hearing loss, moderate, severe, profound. And the higher it is, of course, it means the higher the hearing loss and more effects to your quality of life.
You said there's the mild to severe. What is first the normal hearing?
Yes, so the volume is 0 to 25 decibels. That's why you want to be able to hear. When we say that, so this is measured, whether you are looking or not, you can actually hear a tone that is introduced. So you're blinded.
Oh.
Okay? Whether they put that sound at 100 decibels or whether they put it at 0 decibels, your work is to figure out in a soundproof room, can I hear the sound or can't I hear the sound? Okay?
So
now,
even when it's at 0, I should be able to hear
now,
it?
if you told me you are deaf, I would first tell you you're not deaf. We're having a conversation.
Yes.
And conversational speech can go up to around 30 to 40 decibels. Now, we no longer say deaf because deaf you're saying 0. You are hearing nothing. So it might be very high sounds over there. So basically you can be able to get the level of hearing for someone through a very simple way of you being introduced to sounds at different frequencies. When I say different frequencies, if you take a dog whistle, we might not hear it, but the dog hears because they hear at a different frequency.
Yes.
The human ear has also a range of frequencies that we know that you should be hearing. There's also suprathreshold. A bat. A bat, if it was possible for me to do a hearing assessment, it will be on another level. So there is very simple, clear hearing assessments that are done daily, if not, probably today we've done almost 10, 20.
So it's a procedure that can be done within a day?
Less than even 20 minutes, you'll be able to know your level of hearing.
Okay. And when we're talking about, first you brought in people with hearing impairment, so they really do not hear anything?
So remember there's the degree?
Yes.
So the higher the degree of loss, the worse the effect,
Okay.
right? So it means that for someone who has a hearing loss, there's some that we can actually intervene and operate or do something to correct it. And when we say that, if you have a hole in your eardrum, it means we can repair the eardrum and restore the normal pathway, right? If you have wax that is blocking your canal, I can easily go clean it out over there and you hear.
Yes.
If a child comes here and has stuffed clay in the ear, we can sort out that. If, let's say, for example, someone now got a punch, and let's even say you got meningitis and your hearing loss is there. Now, that's the inner ear. That's a totally different thing. So there's some people we end up with hearing aids because a hearing aid is able to amplify your level hearing for you to hear. There's some people we operate, and then there's some people now we do what is known as cochlear implantation, which is to actually restore hearing because your inner ear has been affected. Yes.
Okay. Now, I would love to have now, what are some of the treatment options that do exist for ear conditions?
Okay. As simple as cleaning, as simple as if you have, let's say, for example, the holes in the eardrum, repair the eardrum. If you have an infective process, there's surgeries that can be done to clear not only the infective process but repair what is destroyed. But over and beyond that, I would want to say there's some people now, let's say age. You're hearing at 70%. And when you go to church, you can't hear and you have to sit at the front. If you get a hearing aid, you're okay. Now, for the people where their inner ear is affected, these kids who have been born preterm can't hear nada, then you can do a cochlear implant, which is basically a surgically implanted implant in your inner ear to be able to send that signal.
So it's inside?
Yes, it depends with what is causing your hearing loss. Yes.
Okay. And for the hearing aid, how fast does it look like?
Oh yeah, that's a good question. People find it cool to wear glasses, right?
Yes, it's very cool.
I mean, that's why we wear shades, all right?
Yeah.
That's why you will not find on the streets, even on the traffic, they're selling shades, right?
Yes.
They seem cool. But if you talk about it, it's just because also there are people who wear glasses for corrective reasons. A hearing aid is as good as glasses. You have a deficit, and if your hearing is at 50% and they can amplify it to 100%, you're able to hear. hear. Now, hearing aids no longer are those big, bloggy, brownish, big things.
Yes.
They have undergone a lot of technology from analog to digital. There's hearing aids that have even been made as minute and as small that I can be seated next to you and you don't realize I have a hearing aid because they're in the canal. Do you know that there are hearing aids that can even connect to your phone?
Ooh,
People look
that's
like
cool.
I'm seated over here and then you just see someone, ding, then they start speaking because their hearing aid is connected to their phone. And so hearing aids have undergone a lot of technological changes to make them as minute, as small as they are, as amplified and as techy as they can be. And that's why we always tell people a hearing aid does not serve you any purpose being in a drawer. It needs to be in your ear. No longer is that adage of it has to be bulky and ugly looking. That's why it has undergone a lot of can I say technology changes.
Okay, and what are the potential complications of living probably an ear infection untreated, or even, you know, hearing loss?
Probably most people will want their infections treated. So whether they come to us, whether they're in the village or what, they will definitely see a doctor. Now, probably the impact I would want to talk about hearing losses is the financial impact.
Yes.
The social integration that is affected. You can imagine that child who's told they don't listen.
Yes.
And so what happens? The academic performance goes down because remember they can't hear. So there is a lot of financial, socioeconomic kind of effect to it. And in the long run, as I told you, if you are able to pick up these things early and you can actually be able to rehabilitate or restore hearing for this child, we should be able to have the same kind of life, right? And we've had that through the cochlear implantation group.
Okay, Daktari, as we wind up, probably what are some of the lifestyle changes that people should adapt to for good hearing, and your final do's and don'ts when it comes to taking care of the ear?
The ear is as vital as your heart. It's as vital as your eyes. And leave your ears. The ears can be kind to you. You just don't have to go and probe them. However, if there's pain, if there's hearing loss, please see your doctor. You can actually be able to salvage that. Over and above that, kids are always being born. If there's anything that I can say today, newborn hearing screening. Preventative medicine is way better than curative medicine. And as the World Hearing Day comes in and we are talking about empowering ourselves, that child who's been born and has undergone hearing screening and you have the peace of mind to know that my child is hearing, saves a whole generation, if not generations to come. The child who has no hearing also saves another generation because you're able to work on it early, right? But beyond that, happy ear day. I remove the Y. Happy ear day. Leave my ear.
Leave the ear alone.
Leave the ear.
As the last question, Daktari, there's always the ear drops.
Yes.
Someone just feels a little bit, you know, a disturbance, there's the ear drop to treat it. What's your advice for that?
Wacheni kuku nini mafuta ya kuku? Acheni mafuta ya, is it kondo? The tail?
Yes.
If there's pain, take a painkiller. Come see the doctor. Well, if an insect walks in, probably that time you can put a cooking oil, because an insect will not give you peace. And when I say that, we've seen cockroaches, you just have to stay for it. You can put that. Beyond that, take a painkiller, come see your doctor.
Come see your doctor.
Wachana na hizo mafuta zingine.
Above and beyond, it's Happy Ear Day.
Happy Ear Day.
Thank you so much, Daktari, for having us. It has been a joy and pleasure hearing and learning from you on some of the ways that we can take care of the ear as well as our hearing. And that is it for us on this particular episode. I hope that you back at home have grasped one or two ways that you can care for your ears as well as your hearing. This is all from me here tonight on Body Garage. Thank you for always keeping it TV47. It is always a pleasure. Have yourselves a lovely night.